Friends, welcome to the New Look Indian Heart Journal. At Indian Heart Journal, our mission is to promote research done in India, to provide platform to the Indian researchers, to highlight innovations done in India. As a first part of the series, we present to you Dr. Sadanand Shetty, who has done a pioneering research on a truly made-in-India molecule, the saroglitazar, a drug with a fascinating and unique mechanism of action.
We have with us today Dr. Sadanand Shetty, who is professor and ex-head, Department of Medicine and Cardiology, Dr. D.Y. Patil University, Navi Mumbai. He is the lead author of observational study of saroglitazar in Indian diabetic dyslipidemia patients. Welcome here today, Dr. Shetty.
Hello, Dr. Soumitra.
Hi. May I ask you, as I was mentioning, there is a huge study just published. Could you please introduce us with the study?
Dr. Soumitra, this particular study is the post-marketing, multicentric observation study in a patient of diabetic dyslipidemia all over the country. And this particular study basically done to show the efficacy as well as the safety of this particular molecule, saroglitazar, which is available to us since September 2013. And in this particular study, all the patients received 4 milligram saroglitazar along with the anti-diabetic medicine as well as related lipid lowering medicine as per the clinician's viewpoint. During the study, we have demonstrated that there is a reduction of triglyceride to the tune of 35%, non-HDL cholesterol approximately 25%, as well as improvement of the A1C by nearly 0.9% absolute value, as well as the safety data, particularly in relation to the renal side effects, cardiac safety, as well as producing edema or weight gain, etc. So what we have observed during this particular study over a period of 3 months, that it is efficacious in controlling both diabetic parameters as well as the lipid parameters, and it is safe unlike the previous glitazar in the real world practice. Earlier glitazar all are predominantly PPAR gamma, whereas saroglitazar is predominantly PPAR alpha and optimum PPAR gamma. Because of this particular structural modification done by this research group, the side effect profile is not observed both in the preclinical and in the clinical group.
Now, being a cardiologist, how important do you think is non-HDL cholesterol measurement in your routine practice? And if so, how do you fit saroglitazar in the treatment of non-HDLC and to bring it to its target?
This is also a very important question in our real world lipid practice, Dr. Soumitra. What we see in diabetic dyslipidemia, what we call as a triad of dyslipidemia, like high triglyceride, low HDL, and increased amount of small dense LDL syndromes, will be missed if you don't do non-HDL. If you go only by the LDL value, it may appear it is near normal or mildly elevation, but when you calculate non-HDL, it may be more than 30 milligram. That's what we do in our real world practice. I personally a strong proponent of non-HDL cholesterol, and that is well supported currently by NICE guideline 2014, Joint British Society guideline 2014, as well as the latest current 2015, American Association of Clinical Endocrinologists and American College of Endocrinologists, suggesting that non-HDL cholesterol is one of the important parameters to be studied in the real world practice. And I personally feel in our country, particularly the triglyceride is the basic metabolic disorder to start as a starting point. In our lipid problem, it has got more relevance. So I would recommend strongly every clinician, after doing the initial lipid profile once, doing the follow-up, doing total cholesterol and HDL, which can be done easily in your office and cheap, simple calculation, and this non-HDL will measure all bad atherogenic lipoproteins almost like a surrogate of ApoB.
How do you see the role of saroglitazar in the management of metabolic syndrome, maybe along with metformin in the Indian scenario?
Dr. Soumitra, I feel saroglitazar has got a very important potential role in insulin resistance. Both preclinical and in the clinical experience, we have shown that saroglitazar reduces triglycerides significantly, at least by 35%, improvement of HDL at least by 15%, and non-HDL cholesterol improvement at least by 24 to 25%, and also reduction of A1C approximately by 0.9 absolute value from the baseline. This is weight neutral. I personally feel this particular molecule has got a very great role in treating insulin resistance syndrome.
Do you have any anecdotal evidence of benefit of this molecule in other territories, say for example in liver?
There are phase 2 studies shown that when we use saroglitazar in such patients, ALT level reduced, suggesting that there is improvement of this particular condition. So I personally feel there is a strong claim for using this drug in this particular fairly common disease or a common clinical condition or practice, maybe alone or maybe in combination with other drug like maybe metformin. And already phase 3 trial is initiated in this direction, which I feel and I am very sure that the result will be positive and we will be having one more indication to use in our clinical practice.
Thank you, Dr. Shetty. It appears that this particular unique molecule saroglitazar is made in India, made by Indians and made for Indian population, has got a hugely bright future. Thank you very much for being with us today in the studio.
Thank you.
Friends, welcome to the New Look Indian Heart Journal. As part of the series, I would like to invite Professor Upendra Kaul, who is well known to all of us. He is an academician par repute and a teacher of teachers, and who is the director of Fortis Escorts Hospital at Vasant Kunj. So good evening, sir. So how do you like the New Look Indian Heart Journal, sir?
There is no doubt that this new look is really very impressive, attractive, and it's not only the look, the contents are also different, and the style is different, and the choice of articles, very topical articles, and it really, I think, is a good achievement, and I'm sure it is going to be maintained.
So as part of the series, we have started initiating interviews with the leading experts in the field about the major articles that are published in the Indian Heart Journal. As part of this, we are going to talk about the observational data that is presented about saroglitazar in diabetic dyslipidemia patients who are from India. It's the first molecule that is developed from India, which is a new in class. So what do you think about the molecule?
This molecule also has a peculiar property, being a PPAR alpha gamma agonist. It not only reduces the adverse components of the lipids like triglycerides and increases modestly the HDL cholesterol and LDL cholesterol also modestly, although we are also looking into what does it actually do to small dense lipoprotein cholesterol. But what I am trying to say is, not only does that, it also improves the glycemia control. On an average, about 0.9% reduction in the HbA1c is a salutary development, that it seems that it controls the diabetes better without increasing the dose of oral hypoglycemics. In addition, looks at the adverse lipids and gives them a better profile.
So thanks a lot for your words of wisdom. Good evening, friends. As part of the Indian Heart Journal video series, we are here to interview Professor S.C. Manchanda, who was formerly HOD and professor at All Indian Institute of Medical Sciences and currently the chairman of cardiology at Gangaram Hospital. So welcome, sir.
Thank you.
So how do you feel about the New Look Indian Heart Journal?
I think this is very good. It's different than the usual one. I have been reading Indian Heart Journal for the last about 50 years and all. So this gives a new fresh look. And what I like most is that now this has become the modern journal, because you are having so many tweets, you are having all the modern IT things involved in this. And therefore it's going to interest the youngsters quite a lot.
So, as part of the endeavor, we are planning to cover at least 2 articles every issue in a video format. So have you gone through the article about Saraglitazar, the post-marketing survey, and what do you think is the highlights of the study?
Yes, I have gone through that article. I think the highlight of this article is that this is one of the few drugs which has been entirely developed and approved in India. And this drug is not only approved in India, but it's going to many other countries also. And this is a very, very unique achievement by India. And Indian Heart Journal has put it on the forefront. And it really is a very, very interesting drug, because this is a drug which was used for diabetes, but is equally interests the cardiologists because it has significant effects on the triglycerides.
What are your suggestions for Indian Heart Journal?
I think Indian Heart Journal should really highlight the work done by the Indians and all that, especially in those fields which are really neglected by the outside countries. The big problem in this country is that we have a huge problem of cardiovascular disease. We have to think of some cheap, cost-effective and safe remedies to tackle this disease. We should not really follow the Western journals because they are really not very much cost-effective for most of the time. I was mentioning, I'm very glad to see that Indian Heart Journal is giving a lot of emphasis on lifestyle management like yoga, etc. I have myself written it. I think such newer things and some of the drugs which are developed in India, if they are highlighted, they could be greatly useful. But I think the most important thing which Indian Heart Journal should do is to really encourage such articles which suggest that the heart disease can be tackled in this country because it's increasing markedly, and there should be a lot of emphasis on prevention.
So thanks a lot. Thank you for spending your valuable time.
You're most welcome. It's a pleasure.